We want to begin by introducing you to Pragya. Pragya, a sister, writer, and engineer, recently immigrated to Canada from India. Pragya is frustrated because over the last 4 months of being here, she hasn't had the perfect opportunity to settle down and begin a new, fresh life for herself. She's currently living in subsidized housing in Hamilton, Ontario. Unfortunately, she has had to move between 3 different houses, all of which were old buildings that lacked appropriate ventilation, good lighting, adequate space, or community. To make ends meet, Pragya works as a cashier at Shoppers Drug Mart during the day and as a waitress at a local Greek restaurant during the night, both of which allow her to earn minimum wage. By the time she gets home, Pragya has no time to unwind, watch TV, or make a meal for herself. She usually just goes to sleep so that she can be on time for her 5 a.m. shift the next day. Between the lack of social and family support in Canada and paying for transportation to work, rent, clothing, and her citizenship certificates, Pragya often finds herself accessing food banks and eating non-perishable foods. Recently, Pragya found herself being in a state of extreme fatigue, feeling chest pain, shortness of breath, and rare fainting. After 2 months of putting it off, Pragya finally got a short break from work to visit her local clinic and doctor. After waiting for 3 hours to see the doctor, he told Pragya that she may be at risk for a heart attack and that she should exercise for at least 30 minutes a day, maintain a diet that's low in salt, and keep a healthy weight. At this point, it is important that we stop to ask ourselves, what has led to Pragya having a high risk of heart attack? Well, the medical answer is that Pragya's coronary arteries were starting to get blocked. However, in reality, Pragya is affected by various other non-medical factors. The fact that Pragya does not have stable housing, is food insecure, works low-income jobs, is a recent immigrant, and lacks social support all contribute to her negative health and well-being. Would Pragya's healthcare provider have benefited from knowing more about her social context? Would his recommendations for her have changed? These social and economic factors mentioned are known as the social determinants of health. These are apparent in the non-medical living and working conditions that people experience every day. These determinants influence health in many positive and negative ways. In Pragya's situation, her housing, income, and immigrant status all affect her health in negative ways. Despite the fact that social, economic, and environmental factors play a significant role in determining an individual's short and long-term health outcomes, and medical care, which focuses on healthcare and not health, limits physicians' abilities to effectively address these factors within their practice. This leads to a significant gap between the prescriptions, recommendations, and referrals that are currently made versus the one that should be made under a more holistic, comprehensive, and wraparound model.
To address this issue, researchers, community organizers, and hospitals have been working to develop frameworks and tools to collect and analyze patient socio-demographic information. This process of systematically documenting patient social determinants of health data is known as screening, which currently occurs in a variety of inpatient and outpatient healthcare contexts for both primary and specialty care. Now let's go back in time and see how screening and referrals for social determinants of health could have helped to address Pragya's social needs and reduce her risk of a heart attack. While at her local clinic, the receptionist informs Pragya that the clinic is gathering important information about her in order to provide better care. She asks her how she would prefer to complete the form, either by herself on a tablet or with her healthcare provider. This questionnaire, developed as part of the Everyone project, includes 11 questions that aim to screen for Pragya's social needs. It asks Pragya to answer questions related to her housing, such as what is your housing situation today? And think about the place you live. Do you have problems with any of the following? With options such as bug infestation, mold, lead paint, or pipes. It also asks about her food, transportation, utilities, and personal safety circumstances. Near the end of the questionnaire, Pragya is asked whether she would like help with any of these needs. Pragya selects yes. Once Pragya completes the questionnaire, her responses are immediately sent to her doctor and integrated with her electronic health record. After reviewing her completed questionnaire, Pragya's doctor calls her in to discuss her needs. Currently, there are many models across the world, such as the Thrive Project in Boston and the Spark Project in Toronto, that have been piloting an electronic health record integrated social screening system. Unfortunately, one of the main problems is that physicians are scared of opening up conversations with their patients that they are unprepared to have, along with not having sufficient knowledge of social services available to address their needs. For these reasons, it is important to take screening for social determinants of health one step further, having an automated referral system in which health providers automatically receive information and recommendations on resources to address social determinants of health once the patient's information has been inputted. We propose a system known as eBridge that automatically generates a custom list of organizations and other service providers within the EHR that a doctor can refer or provide information to their client about based on their responses to the questionnaire. To make this process client-centered, doctors can then consult with their client to determine which services they would like referrals for and then select the referrals to be automatically sent to the partner organizations and services. For some physicians, these social challenges may seem insurmountable, but it is important to remember that they are not alone in helping address and solve the problem. Instead, they are in the ideal position to connect their clients to local resources and support networks to improve their life circumstances. Given the recent healthcare transformations within Ontario, the Hamilton Health Team, a chosen Ontario health team, will be important in the implementation of eBridge. But first, we should understand what Ontario health teams do and why they will play an important role in Progya's health. Ontario Health Teams, a new model of care created by the Ontario Ministry of Health, brings together different types of healthcare providers, social services, and community organizations to work as one team for a defined geographic location. Their vision is to create a person-centered and family-centered delivery model that provides 24/7 coordinated care. It ensures that Pragya will be able to digitally access care, access her health records, and play an active member in her own health. The Hamilton Health Team itself is a collaboration between various social services and health partners, which includes representation from community agencies, hospitals, primary care, and mental health. These partnerships are a catalyst for coordinated care and allow for the sharing of information between and among providers through digital tools such as the electronic health record. Now let's return to Pragya's situation. After indicating that she is worried about not having stable housing, that she is working multiple minimum wage jobs, and that she is experiencing food insecurity, eBridge identified many resources such as Indwell, which provides assistance in finding safe and affordable housing. Those who are partners with the Hamilton Health Team receive an e-referral within the Ontario Health Team's established digital platform and then contact Pragya directly with an appointment. The e-referrals will help Pragya's family doctor find services closest to her. Using a provincial database, Pragya's family doctor can also track that status of her housing experience, update her digital record, and have virtual video visits to ensure she is following a healthy lifestyle. Although the main aim of eBridge is to collect data on social determinants of health in order to help healthcare providers connect individual clients with community resources, another important aspect of this tool is its evaluation. To ensure effectiveness and continued improvement of the tool, eBridge will undergo ongoing evaluation. The feasibility of eBridge will be evaluated by measuring the amount of time it takes for an individual to fill out the questionnaire, the number of patients that agreed to complete the screening tool versus the number of patients seen, the number of unique referrals made, the number of referrals fulfilled, and feedback from other healthcare providers. Collected data on these indicators will help us better understand how eBridge is helping our clients and what is needed to improve the experience for everyone involved. We hope that you are now able to understand how eBridge, an automated EHR-based screening and referral system for social determinants of health, provides a multitude of benefits to improve the health of thousands of people every day, just like Pragya.